Does the timing of your meals influence your appetite? Hi, my name's Luke from Active Health Clinic and welcome to our third video in our appetite series. This is one of the most common questions that I get from my patients when we're trying to work out how to stimulate their appetite again and get their appetite back and get them enjoying eating and food again. And what I really like to say as my answer, which, to be honest, annoys some of my patients a little bit, but it's the truth, is yes, but it's flexible. Now, I know this type of not straightforwardness doesn't work for a lot of people, but hear me out. Let's go back to our previous video, our appetite session 2, or video 2, where we talked about going back to basics and understanding what your food routine was like in your childhood. If we think about those meal timings, as in the space of time that came in between meals, they were all pretty consistent. Now, I'll let you do the math and actually work that out for yourself, but those meals happened day in, day out, at least 5 days a week. What we need to do is figure out what the timing, what the amount of time, the space in between those meals was, and apply that to our lives today. This becomes really important because your life probably consists of a whole bunch of different things that weren't there when you were 5, 6, 7 years old. You'll have work commitments. You might have commitments with family. You might have kids of your own that you're having to manage their lives within your own life. You might have study. And all of these things complicate this idea of having a consistent food routine. That's why we need to be flexible. So there's 2 things I want you to remember today from this video. Number 1, when trying to work out whether the timing of your meals influences your appetite, you need to remember the basics that we talked about in the last video and I just described. Work out what that time period was in between your meals and try your best to apply it to your life now. And the second thing I need you to remember is that needs to be flexible. Work out what your non-negotiable things that you have to do during the day are. And work out those meal times around that to try your best to fit those meal times within those time periods that you were used to when you were younger. When we put all this together and we start doing it consistently, that's when we start really noticing the benefit of this strategy and of this structure. If you found this video helpful and think someone else that you know might find it helpful too, please tag them below. Please like and subscribe to our YouTube. And if you feel like you need more help digesting this information or actually implementing it into your life, please feel free to put up your hand and one of us would be more than happy to talk to you about how to actually go about doing this in your day. At Active Health Clinic, we're trying to impact 1 million people with invisible illnesses before 2022, and you doing these things helps us to reach that goal, I should say, even sooner. Thanks for watching and happy eating.